Good morning, everybody, and welcome. I'm John Finnegan, Dean of the School of Public Health, and I'm so pleased that you are joining us today as we explore careers of impact and our 2021 alumni awardees. And I'm going to introduce them to you shortly. But before we start the conversation, we have a few housekeeping notes for you. So this event is really going to be best viewed in the speaker mode. And you should feel free to use the chat function during our event today. You can send messages of congratulations to our awardees, or you can reflect on what you are hearing. And we won't have a formal question and answer period, but our team behind the scenes will be keeping an eye on the conversation in case any questions arise that we can't answer in real time. So also keep in mind the event will be recorded, and we encourage you to share it after the event. Well, I've said it before, and I think it always bears repeating. This school's greatest gift to our state, nation, and world are the graduates of our programs. As alums, they go on to make a mark in the world of health, whether that be public health practice or science, or healthcare leadership. They are leaders, all who have discovered pathways of influence and change across the broad spectrum of public health and health systems. And today we're exploring the stories of 5 individuals, their career journeys, why they're passionate about what they do, their work, and how they exemplify our school's values. We know that they represent a much greater collective influence of all of our graduates to challenge the upstream root causes of health inequities, whether in communities and populations or in the improvement and reshaping of health systems. The school itself has been doing this kind of work for more than 75 years now. And even before there was a school, the University of Minnesota has been a national leader since 1872, believe it or not, in educating generations in public health science, practice, clinical care, and health system organization. That is an enormous legacy of which we can be quite proud. In terms of training and education, ladies and gentlemen, academic public health began right here in Minnesota. Not back east or out west, right here in the heartland of the upper Midwest. And that first generation surely started us off in the right direction in the 19th century. Now, since the school was founded in 1944, we have educated more than 12,000 alums. And today we honor just 5, and we are proud to have 4 of our graduates who have accomplished great things in service to public health and health care. And I want to introduce them to you right now. The Gaylord W. Anderson Leadership Award is the highest award that the school gives to its alums, and it recognizes well-rounded, exceptional leaders in public health with a commitment to the advancement in the future of the field. Don Wegmiller, who is chairman and co-founder of C-Suite Resources, is this year's awardee. Don is a 1962 grad of the Master of Health Administration program, and since graduating from the University of Minnesota, he has stood out as a visionary healthcare leader, teacher, mentor, and patient advocate. And we will hear more from him and all of our alums in a little bit. The Alumni Award of Merit honors the exceptional service in public health, and this year's awardee is Dr. Julia Joseph DiCaprio. Dr. Joseph DiCaprio is a senior vice president and the chief medical officer at UCare. She received her MPH in maternal and child health in 1996, and she has dedicated her career to integrating public health into systems of care, resolving health and racial disparities, and bringing health plans and communities together for patient-centered change. The Alumni Innovator Award is just as it sounds. It recognizes a graduate who has made, developed, or implemented innovative ideas, approaches, or solutions to public health problems. Stephanie Farnia is this year's awardee. And Stephanie is principal at Nimitz Consulting and has spent 15 years developing strategic solutions to complex healthcare reimbursement and access issues, especially those that come with medical innovations. Stephanie received her Master of Public Health degree in 2004 in Public Health Administration and Policy. The Emerging Leader Award is presented to Dr. Charles Rogers. He is an assistant professor in the Division of Public Health at the University of Utah School of Medicine. And this award is given to an alum who has made a significant impact in their field within 10 years of graduating from the School of Public Health. Dr. Rogers' leadership has been demonstrated through his collaborative work in using community-based approaches to develop, implement, and evaluate culture-specific interventions. And he has established a far-reaching research program on colorectal cancer awareness and prevention among African American men. Dr. Rogers received his Master of Public Health Administration and Policy in 2017. And the Outstanding Mentor Award goes to Beth Hines. She's a 2008 graduate of the MHA program, and Beth is the executive accountable for mental health and addiction services in women and children at M Health Fairview. Beth is a stalwart champion of public health students. She has mentored them through the SPH Mentor Program and coached and advised students as they grow their skills in healthcare leadership. So, our congratulations to all of our awardees. And if you are interested in learning more about each of them, we'll be sharing their individual stories over the next month or so in emails, on social media, and of course in our Advances magazines. And these spotlights are part of something that we're calling our 40 Days of Gratitude. And this is a time over those 40 days for us to celebrate the successful $40 million fundraising campaign that we have just completed at the school, and also to thank the loyal community of public health folks and many others who gave so much to our school and continue to give to our school and to public health. But now, before we start our discussion, let's take a moment to get to know this year's awardees.
Privileged to be inducted into the Healthcare Hall of Fame. And they said, what Don did was take an idea of how hospitals could join together to be more effective, more efficient, and closer to the communities they serve into a system. And we took those two hospitals up to 23 hospitals, 300 employed physicians, and really created kind of the first system here in the Twin Cities.
I spend all day thinking about reimbursement related issues and access for innovative cellular and gene therapies. One of the key things I think that we managed to do was to pull all the stakeholders into a big working session, trying to help the physicians understand the world of insurance and the insurance folks to understand the new technologies that are coming out. Everyone's had family members or friends impacted by a number of these diseases, and they want these new therapies to get to them. I think we can't get anywhere as a system unless you understand each of the stakeholder perspectives and the role that they play in making decisions about how we fund healthcare.
So my work at UCare has a population health approach to all of our work, addressing the social drivers of health and advancing health and racial equity. It's really hard to manage your heart disease, your diabetes, if you have unstable housing, for example. And we work with them and their communities to understand that. And we tailor our initiatives to address those social risk factors, those social drivers of health that are actually barriers to folks achieving optimal health and wellness.
So our empath unit, which was the first in the state of Minnesota at Southdale, is similar to an emergency room, medical emergency room, but it is for mental health. On average, if somebody arrives at a medical ER with a mental health issue, 60% of those patients are usually admitted to an inpatient mental health bed. If you go through an empath-like treatment, we're only admitting 16% of our adults who are serving in that different care model. And so it was really exciting to see that come to fruition. And it was really based on an MHA student group who was really innovative and forward thinking.
2018, I was funded about $900,000 from the National Cancer Institute from our study called Cutting CRC. For me as a Black male, I have a 47% higher chance of dying from colon cancer than a white male. And Cutting CRC is focused on developing a barbershop-based intervention on masculinity barriers to medical care to increase colorectal cancer screening completion among African-American men in Utah, Minnesota, and Ohio. When I got the stamp from the National Cancer Institute, which is underneath the National Institute of Health, for that, I was like, okay, maybe I know what I'm talking about.
Fantastic. Thank you so much for the video and the team that put it all together. That's terrific. Well, now we come to the fun part here. We get to kick off our conversation. And the first question that I have been invited to ask everybody, and this has to be a really short answer, so we'll keep that in mind. In one word or in a phrase, describe what it means to make health a human right. Let me start with Dr. Rogers.
Dismantling systems of oppression to ensure equitable health for everyone.
Fantastic, thank you. Don Wegmiller.
To have everyone in our country have affordable access to all elements of health.
Very good, I like that. Dr. Julia.
Well, thank you, Dean Finnegan. And actually, I'm going to take a moment to thank you for your 15 years of leadership for the School of Public Health.
Thank you.
Here,
I also want to thank Susan Lepke for nominating me, the selection committee, Heidi and Sarah for organizing this event, and my family for their support. And when I think of health as a human right, I think about the definition of health equity that many of us use, which is that everyone has a fair and just opportunity to be as healthy as possible.
Fantastic. Stephanie Farnia.
I think about the money all the time. So I'm right with Don and Dr. Julia. So affordable and equitable access to quality care.
Absolutely. And Beth Hines.
Thanks, Dean Finnegan. When I think about one word, I think an imperative. It's really an imperative as a human right to have access to affordable health care.
Fantastic, thank you. There's no question those reflect some of the central values that the school tries to instill in our graduates, as you know. So let's begin our discussion. And Dr. Rogers, you received your Master of Public Health in 2017, and you've already proven yourself to be quite a leader in the health inequities area with a specific emphasis on colorectal cancer among African American men. So can you give us a little sense of what leadership skills that you are using to create the positive change around this issue that we need?
Absolutely, Dean Finnegan. Three things because of time. One, I would say team science. I often say that team stands for together, everyone achieves more, because it's really true. Instead of trying to be good at many things, I aim to be a master of one and partner with others who are masters of their particular skill or research area. By leading with a spirit that pushes my team members to be unapologetically masterful, these collaborations allow deliverables to progress at warp speed. Two, servant leadership. Many of us are familiar with the words of Roosevelt that nobody cares how much you know until they know how much you care. I practice this principle in nearly everything I do and those I closely interact with, whether I'm helping one of my lab members get to the next level or on NPR aiming to increase the community knowledge about colorectal cancer, or always open doors for my amazing wife so she doesn't have to. Serving others is my lifestyle. It's not performative. And lastly, focus. Comparison is a thief of joy, so I focus daily on improving myself and my craft. In my opinion, the person I see in the mirror every day is my biggest opponent.
Wow, thank you.
Beautiful.
Thank you. That's very helpful. Don, you know, you're someone that's been working in healthcare for more than 35 years, and thinking about that experience, I think we're interested in hearing what your perspective is on the current challenges that we have in this country with respect to public health, healthcare, and I would say also the skills of our students that are going to need, that our students are going to need to develop to meet those challenges in the future here.
Yeah. Well, I think we'd all agree that there's a long list, unfortunately, of current challenges. So let me just tick off what I think are 4 of them. One, and Dr. Julia spoke to this already this morning, and that is the social determinants of health became only recently focused on, and we have not all aspects have been addressed, and yet will need to be continually addressed if we're going to deal with health. Healthcare is only a small part of our mission. And so looking at what those social determinants are that impact health is one of the challenges. Secondly, we have an enormous lack of adequate numbers of healthcare professionals. It's a persistent lack of supply that is not being addressed. And the pandemic only worsened those shortages and will continue to do that if we don't have a national commitment to staff adequately all aspects of health. Third challenge is lack of access. Any of the participants this morning would agree that affordability is one of the aspects, but we also have deserts. We're all familiar with the term food deserts, but we have health deserts where we don't have available clinics, available personnel, available sites of assessment. And our fourth challenge among many is a lack of focus and funding for public health on a national basis. And the pandemic demonstrated that, unfortunately and painfully. So those are 4 challenges. You also asked, Dean, what our students might focus on to address these and others. And I think there are a couple. One is your aspect, your sector of public health will only deal with a small portion of the public health challenges. So I would say that developing skills and learning techniques of forming and assisting in developing partnerships, alliances, collaborations, where groups of public health experts can bring together solutions and key elements of success. I think a second set of skills or actions would be to understand everyone, whatever aspect, whether it's biostatistics, epidemiology, healthcare administration, understanding what are the social determinants of health and how do they impact, and how can we develop partnerships and alliances of public health sectors to deal with the social determinants that are impacting health significantly. And third would probably be the whole area of gaining understanding of social psychology, group psychology, as a part of public health. Because if we're going to work together, we need to know, how do groups work? What are the social elements that make an organization successful or an alliance successful? So I remember, just to conclude, when Professor James Hamilton, the founder of the MHA program in the school, brought together the graduating residents and said to us very simply, if you think that what you have learned or what we have tried to teach here is how to run a hospital, you have missed the entire point of this education. That's not what this is about. What we've tried to teach are principles of organization and management of any entity. Could be General Hospital, could be General Mills, could be General Motors. But the key thing is, how does an entity come together to do that? And I think that's perfectly applicable to what the students need today and have always needed, for that matter. Thanks.
Yeah, thank you, Don. I would agree with that. I think that the issue of coalitions in particular, health is too important to be left only to experts in health, shall we say. It's really got to involve public and private coalitions. And we're seeing that in a whole variety of areas out there, and in publications and books and the work of the National Institute of Medicine and so forth. So I couldn't agree more. Building those partnerships is going to be important. Well, Beth, let me move to you. You know, you're being honored for your outstanding commitment as a mentor to School of Public Health students, and you know, and this is certainly apropos of what Don was suggesting, that we need to be teaching in order to be prepared for the future. So why is it that you chose to volunteer your time? You continue to do this. Why do you volunteer your time in this way? And what would you say, why do strong mentors matter in healthcare leadership?
Thanks, Dean Finnegan. I'm glad I actually can go right after Don, because I don't have to repeat much of what he mentioned in terms of public health. My area really of where I focus my energies is in healthcare particular. And it is such a joy to work with incoming new talent to healthcare who want to lead in these very challenging times. As you heard Don outline, these are really unprecedented times in healthcare. My career in healthcare has been one of passion and dedication really to the patients and the communities that we get to serve. And for me to be able to share that passion with students is actually a gift back to me. And one of the things that I really focus on is helping new students in the area of healthcare really discover what their passions are. We need new talent. We need new thinking. We need innovative ideas. And we are really desperate for that type of leadership. So anything that I can do to help our students recognize that and find their niche and to be able to contribute really just comes back to all of us and all of our communities. So for me, it's a privilege and an absolute joy to be able to mentor new students and to help support them to be able to connect and really find where they want to contribute. And secondly, so many people reached out and mentored me throughout my career that it is really feels like how I need to give back. And so it's just a pleasure.
Pay it forward.
Yep.
Beth, let me ask you a follow-up question real quickly. As you're dealing with the current generation of students, I think I would say late millennials or Gen Z students, tell me what you're finding about what drives them into public health, healthcare, health systems.
It's much of what we were just talking about in terms of our social determinants of health. And I think just a real deep belief that it is a right. Healthcare is a human right for our communities and for our people in the United States, and that anything that they can do to make sure that we've got equitable care, that people receive the same high level standard of care wherever they actually seek it or when they need it, is incredibly important to our new students who are coming into the field, which is really exciting because I do really believe we are at a turning point in our healthcare. And so this group is really what is going to help lead us to some pretty incredible change in the near future.
Yeah, I couldn't agree more. Well, Stephanie, you were chosen as an Alumni Innovator Award recipient because of your track record around coverage and reimbursement for rare disease, cellular, and gene therapies. Can you talk a little bit about the role about innovation, what it plays in the type of innovation that you practice in making health a human right? You're in a very interesting part right now of health, and I'd be interested to hear a little bit about, how does innovation work for you?
Yeah, thanks, Steve. Again, so I think the first thing I would say is, just like everybody else has noted, we have really well documented inequities to even basic care. So then when you're talking about rare diseases and cell and gene therapies to treat those that start at hundreds of thousands of dollars and go up to millions of dollars, those gaps only get bigger, especially when those are administered at limited geographic academic centers and there's multiple trips and extended care episodes. The goal is that everybody that Dr. Rogers gets in to see to get their colonoscopy, and then a few of those individuals, when they're identified for something that hopefully we can treat, that they can get access to that therapy after all of this work and scientific advancement to bring those forward. So I'm kind of torn because my personal efforts, the innovation is really around bringing stakeholders together, and I hope that in the future that becomes table stakes, in the basics of this, right, versus being innovative. But we really spend a lot of time thinking about how do you bring the right stakeholders together? How do you set up conversations in a way that people really understand what the others are saying and what their needs are? How do you get to a solution that provides access to these therapies to the individuals that needs them, but doesn't completely break the economic system that our healthcare is structured on, or further challenge it, because we know it's struggling already. So, I think the really tough decisions in the cell and gene therapy space haven't been made yet, but I think we have to continue to focus on them as part of thinking about health as a human right. A lot of these diseases are really devastating, and they disproportionately affect certain populations, and we've got to continue to shine a light on those.
That's interesting because it sounds to me like you are, bringing the stakeholders together, and in that process, innovation, presumably you have to pull the innovation from the stakeholders together, and that, if I understand what you're doing, that should actually become the standard operating procedure in moving forward, is if you can weave that concept of innovation into your everyday work with those stakeholder groups.
Yeah, I hope so. I mean, everybody's got a piece of it, and these issues maybe differently affect individuals, but everyone has friends and family members that have unfortunately faced these things, and
yeah,
we've got to bring everybody together to bring all the resources and ideas into play.
Yeah. Thanks. And Dr. Julia, in your career, you've integrated equitable population health strategies with clinical care in an effort to create cost-effective strategies for health plans and health systems. And you've got to be at the intersection with community, and particularly the voices of community stakeholders. How do you incorporate those and hear those as you try to achieve the complex goals of health and population health?
Well, thanks, Dean Finnegan, for the question. UCare is a health plan that actually began out of the Department of Family Medicine and Community Health at the University of Minnesota in the 1980s as a Medicaid demonstration project. And the values that led to the founding of UCare, that includes the importance of working with community stakeholders. Those values imbue our work today. And so at UCare, when we take a population health approach to the clinical services that we provide to our members, we work to ensure we have community voices. So we use data and analytics to deeply understand our members, including the barriers they face to optimal health and wellness, and that includes the social drivers of health. And the data and analytics we use, the data we use includes the qualitative data. So listening to what our members are saying and listening to what their communities are saying. And so an example of this would be Well, a little less than a year ago, soon after the COVID-19 vaccines became available, we reached out to various community leaders to see if they would partner with us as we work to improve access to COVID-19 vaccination and to get information out about COVID-19 vaccination. And as we were talking with those leaders, I began to understand and recognize, actually, in some instances for the first time, the concerns that were in their communities about COVID-19 vaccines. And those community leaders shared that they were hearing a lot of skepticism about the vaccine, and they were wary of being associated with COVID-19 vaccination and promoting it. And, it was really surprising at that time because this was when other people were doing everything they could to get the vaccine, including traveling long distances. But that interaction with community leaders and is an example of how we learn from them as we learned around COVID-19 vaccination, and that we have to make sure that we are partners with them as we understand and address the perceptions in their community. This is also an example of the importance of relationships and not having a relationship with community leaders when something monumentous occurs like a pandemic, but being in relationship over years so that when something monumentous occurs like a pandemic, that we are able to learn from them and have them guide our work. I heard a community leader say after the murder of George Floyd, when this was in South Minneapolis, when that community was being flooded with resources, she said, appropriately so, or asked appropriately so, where were you before some of these folks? And I think that's the importance of relationship. Let me end with another quick example. At UCare, we have a mental health and substance use disorder services team, and they actually are guided by key advisors, which are providers, advocates from across the state of Minnesota. And what this group of key advisors do for us, it allows us to understand whether the services we're putting in place are going to be successful, are appropriate, and they actually lead us in many instances so that we think about things a little differently.
Yeah. Let me ask this. I'm going to ask all of you, and maybe I'll start with you, Dr. Julie, as long as we're talking right now. If you can do this in one or possibly two sentences, how did your preparation at the School of Public Health help you gain the skills that you needed to make a difference in your field?
Thanks, Dean Finnegan. Well, some of you may know I'm trained as a physician, and that training really helped me understand how I would understand and work with individual patients and families. But I often say that my training in the School of Public Health was probably the most important training I received, because I was trained to understand populations and find ways to address their needs.
I find that really interesting. I'll let Dean Tolar of the medical school know about that.
Don't tell him. Don't tell him I said.
Yeah, one of the things we've certainly seen is that especially the younger generation medical students coming in, more and more of them want to know exactly what the big picture is. Yes, they're very smart and they try to understand the biophysical and biological aspects of it, but more and more they understand the context of the whole system in which people live and the issues of social determinants.
Yes, because many times, and this may be what those students are experiencing, you're in an exam room and you wonder, how'd we get here? How'd this happen?
Yeah, exactly.
And that's where you go to public health and you go, upstream to try to think about what could be done differently.
Yeah. And it still happens that we get, health professionals, physicians, nurses, others, who have seen their, 10,000th case of type 2 diabetes or other chronic illness and in their practice, and they're saying, isn't there a way I could go upstream and maybe stop what's happening here? So I appreciate that. The point being is that medicine and public health are absolutely complementary in the perspectives that they bring. Well, Stephanie, let me ask you the same question. How did your preparation in SPH help you gain the skills that you needed to make a difference?
It sounds relatively simple, but when I came out, I understood how the healthcare system was funded, and how that funding affects who's making the decisions, how the money moves, and really, got a pretty good sense of, because of how the healthcare system is funded in the US, a lot of our large payers are making decisions every day that impact millions of people's health, right? So I think Dr. Julia's role at UCare demonstrates that very clearly. And really just felt like I wanted to go find out more about that and then figure out how to work in those systems.
Very good. Dr. Rogers, let me ask you, as a recent graduate of the school and the work that you do, how did your prep at the School of Public Health help you gain your skills that have clearly led to some effective leadership?
Wow. I'd say that my training in public administration and policy really helped me never be afraid to raise my privileged voice for compassion, honesty, and truth against health injustice.
Wow. That's pretty critical, because that's one of the things that we all need to keep our eye on as we go into the future. Beth, how about yourself?
So I too actually had an advanced degree trained as a clinician, as a social worker from a different university. And when I entered the School of Public Health at the University of Minnesota for the MHA program, I would say very specifically, even with the advanced training that I had coming in, the way to problem solve and really critically think about issues from many different angles in an exhaustive way really helped me prepare for some pretty challenging healthcare issues that we face today. So that thinking and background was incredibly helpful in also with a very supportive alumni network that I still really appreciate today.
Great, thank you. And Don, you represent a somewhat earlier generation in terms of graduating from the school, but I know that when you were studying with James Hamilton and that generation, and as you've already alluded to in your opening remarks, they had some very specific things to say to you about your leadership and experience and how you turn that into a real pathway to change.
Indeed they did. And Beth, I think, has said it very well. The key thing that they taught that I've stuck with me throughout my career is how to problem solve. And we all, when that was said, well, that's natural. You don't need to study to determine how to problem solve. And we quickly found out that that's not correct. If you can't, for example, accurately define the problem that you're trying to solve, you won't find a solution. So the basic training that we received was, as Beth described so well, very excellent. But beyond that, it immediately in the school and in the healthcare administration program put us in touch with other practitioners in the program, in our own group, but more importantly, with other elements of the school and other elements of the university. We were in classes with pharmacists, with nurses, with physicians, with public health officials, and in that interaction learned how big the healthcare field is and how all of us need to participate in problem solving in our communities, because no one of us or one element of us will solve the problems. And so the school, I think, through its mechanisms, internships, residencies, and other experiences, put us rather quickly into a mindset that you need to work together to solve all of the community's health issues. And it proved to be invaluable in my experience.
Yeah, it's interesting because I know a little bit of the history of this whole area of what we call today interprofessional health education. And it's interesting how it's waxed and waned over the years. And I know in the part of the 60s, it was a big deal. It was really starting to emerge. It came back again in the 70s, and of course now in recent times it's become extremely important as well, certainly since the beginning of the 2000s. And it's intriguing to me because I think it's one of the ways that we're going to improve a lot of issues: equity, healthcare itself, the system and the way it functions. It also helps to break down some of the cultural barriers between the professions, which I think is also important. Well, let me ask this, and it's apropos of the last question, and that is, any advice for our students and alumni as they grow their careers? And Don, as long as I got you here, let's maybe I can start with you.
Take advantage of mentors. Find the Beth Hines of the world and work with them and learn from them and participate with them. It doesn't make any difference what you learn as an individual if you can't broaden that and apply it to others. And those who have gone before you, those who are going with you but in different arenas, can teach you a lot about their experiences and help you learn from your experiences. So mentorship and participating as a mentee is, I think, one of the great things that all students can and should take advantage of. And the school makes that very possible. I mean, they don't develop and run mentor programs, but they encourage people like Beth to be great mentors, and people like Beth are.
And we are happy to say that our mentor program within the school is one of the biggest in the country right now among schools of public health. Well, Beth, I'm sure you would second the motion that Don made there as far as mentoring is concerned. I'd be curious if you could say a word or two about the advice you have specifically for students. You know, when you're mentoring, what does that advice come out like?
One of the things that I often talk to students about is similar to what Don actually stated: reach out and talk to multiple people in lots of different positions. Be gracious with time, be pretty clear and simple in some questions that you ask, but staying connected is incredibly important, and you can just learn and grow so much from staying connected to others and that whole network. I know that network sometimes, I've noticed the newer students feel very uncomfortable with that networking word. So that's been interesting with different generations. There's a much higher connection or comfort level with electronics and to be communicating through electronics. And one of the things I often encourage students to do is, as much as we still can right now, face-to-face or even connecting on through a phone call, which interestingly, I think is becoming more rare, but can be very, very valuable in forming relationships, learning, and growing from others.
Yeah, I certainly agree. I'm glad we have this technology, but it's not a substitute for interpersonal communication, no, face-to-face. Dr. Rogers.
Yes, my advice would be to realize that progress, public health, success, growth, and even life, none of these things are linear. So be encouraged and believe that greater things are ahead for you despite the obstacles you face.
Very good. Stephanie.
I think mine would be to be open to sort of non-traditional public health paths. I came into my MPH program right after undergrad, and it felt like everyone was either going into clinical care, Department of Health, or looking at, international or domestic nonprofits focused on this area. I said yes to an internship call that, really had not sounded like it was maybe going to be my favorite thing or my forever thing, and have just continued to sort of follow that curiosity. Can I learn something? Can I offer something? But I think in particular for people to be open to thinking about the payer space, the biotech space, there's a lot of access and health equity work happening there right now. There's a ton of MPHers in there. There's sort of a pre-COVID, there's a secret handshake. We don't do that anymore now.
Right.
But you know,
fist bump.
Exactly. The favorite folks that I end up working with across companies, like almost uniformly have an MPH as part of their credential. And you just have that sense of, I know you're going to be a collaborator. I know you're going to be a big systems thinker. You know, I know you're going to be somebody that's going to be interested in taking whatever we're working on and making it work for as many people as possible. So just to be open.
I really appreciate that, because one thing that we've learned is that more than 50% of our MPH students end up in the private sector of one kind or another. They're not all going into government public health, and government is not hiring as in the past, as you know. We've lost some. But I think the other thing is that the advantage that you have in public health is that all disciplines are welcome. We see that on our faculty because, in fact, solving the challenges that we have all talked about here is rocket science. It's complicated. It requires that kind of commitment, and it requires the best brains that you can find, which is the other reason why I think networks are so valuable. So for Gen Z, Beth, I guess we'll just have to find another word. If network doesn't work, then we'll find another community of practice. I like that one. That may be the way to go. Dr. Julia, let me ask you the same question. What advice will you have?
Sure. And I actually didn't know that networking was not thought of well, so I learned something today. But you know what? The way I think about the advice I might give to students and to alumni who are thinking about their career is that the values that led you to the School of Public Health, those are the values that will guide you through the rest of your life, not just your career. And so for myself, I've always thought about my values when I'm thinking about what I'm going to be doing next. And I value care to populations that face the greatest barriers to health. So when I'm thinking about what I want to do, I think about, is this in line with that? And will that help me advance, will this career choice help me advance my work that way? And I always think about the quote from Dr. Martin Luther King when I'm thinking about work, or if I'm at work and thinking about, the more sort of operational parts of my work versus the big strategic thinking. I think about Dr. King's quote, and it brings me back to the point of what I'm doing. And his quote that I like is, life's most persistent and urgent question is, what are you doing for others? Oh. And so when I'm uncertain about the path forward, or if I'm thinking, boy, this is just a lot of operational work, but is it really contributing to the point? I think of Dr. King's quote.
Wow, that is inspirational. And that brings us to our last question, and maybe I'll start with you again, Dr. Julia. And this is really the issue of everything that we've experienced in the past 24 months, the burnout, and we see that especially going on in the health professional fields of various kinds, a general sense of energy, over expenditure of energy. So for each of you, how do you face those challenges day after day? How do you find the energy and the optimism to keep doing what you do in making a difference? And Julia, maybe I can start with you.
Sure, thanks, Dean Finnegan. In the anti-racism struggle, I heard a leader once advise that if you're tired, rest. And when we think about the work of anti-racism, of dismantling systems, policies, and procedures that have persisted for centuries and are rewarded today, that's very hard work. So it's not surprising that people get tired and can get discouraged. And I think I heard Dr. Rogers mention earlier that that's expected. And the important piece, I think, is to rest and move forward. I had the experience this past weekend. My husband and I were in a small town in Iowa, and we had two things happen that told me that the work is both rewarded as well as there's lots of work ahead. One was we liked to bowl. We were at a bowling alley, and this gentleman came in with a bunch of children, and he was able to have all these children that he said were a football team, that they were doing team bonding. These little children, one of whom moonwalked into our alley and then moonwalked back because, the floor is really slippery. He was able to, have this group of boys in a bowling alley, and they, even though they were roughhousing, he never raised his voice, and he was really able to have them there in a very calm manner. And this was, as I thought about it, this was everything in terms of the success of those children into the future. So our job is to make sure that we remove barriers so that people like this gentleman can keep doing what they're doing. That night in our hotel, we heard gunshots. And unfortunately, it was a shooting. And then we saw a police involved shooting of a second person. And the first person ended up dying. And that told me that the work ahead is significant. It's hard. But if you're tired, you need to rest and then get back to it.
Yeah. Let me go up to Dr. Rogers, if I could, and ask the same question of you. How do you keep doing it day after day?
Yeah, Dean Finnegan. And so I think there's going to be a theme you're going to hear from most of us. Everything works better if you unplug it for a moment. Since none of us can pour effectively from an empty cup, it's critical to practice self-care daily. Cancel that meeting, get an extra hour of sleep if you're still tired when you wake up. Don't shave your bald head one day. Take that vacation day. Take a walk in the middle of the day. Do what's needed to help you truly and legally be the best you.
Yeah, good words. Stephanie.
When we think about the health inequities and the anti-racism work, I don't think I get to run out of steam there. I think I really need to acknowledge the privilege I've had and how those levels of privilege have impacted other individuals and created harm in a lot of ways. And so I think that's something that I need to be aware of every day and in every setting, and continue to just keep that front and center. On the work side, it's been a tough couple of years, but there's been a lot of optimism in the space, the scientific space that I work in. There's been a lot of individuals with otherwise devastating and deadly cancers and genetic diseases that are starting to get to plan their lives again. We still have a lot of stuff to figure out in terms of how to get those therapies to people, but that's been such a bright spot. You can either think about that you're spending all your time looking at really, really terrible diseases, or you can choose to sort of say, but we're looking at how to impact those and reverse them and prevent them. And so I think that's just personally really motivating to me, is just to see all the incredible science that's gotten us to this point really continue.
Yeah, thank you. The phrase is keep your eye on the prize, right? I think that's a critical part of this that keeps a lot of people going. Beth, let me ask you that question. What do you do to keep yourself going?
Well, in the setting of healthcare, we all know and we're hearing that there is incredible burnout and compassion fatigue. And with the pandemic, I would say we still are not clear from that. And we are really starting to feel the fallout from staff, providers in that setting. So I think what's been really important for me personally, but also to make sure that we're modeling for others, is you cannot give what you don't have. If your bucket is not full, there is nothing for you to give to your team, to the patients that we serve, to each other. So it's been incredibly important to make sure we emphasize that everyone matters, your health matters, and boundaries are important, even in a healthcare setting. And so making sure, for me personally, that I, similar to what Dr. Rogers was mentioning, making sure we're just taking care of ourselves, and that we have to make sure we take a pause and do that. So for me personally, if I didn't exercise 5 days a week, I don't think I would have the energy to keep going, because things are very challenging. So making sure that we eat right, get sleep, and that our buckets are full are very important for us to have sustainability in this field.
Yeah, very much agree. And certainly in the school and our faculty and our staff and so forth, and certainly with students as well, that kind of discussion is going on. It's how do we do those balances in the midst of all the stress and strain, and I don't none of us claim to have all of the answers, but some of the answers are right here, which I think is really important in terms of self-care. Don, you're what keeps you going? And you've been going for a good long time.
Yes. Well, it's it's the cliche, if you will, of focusing on a work-life balance. And to have that balance, of course, you've got to have non-work groups and socialization. And you can't ignore those, and then when you need them, expect them to just pop back up in your life. So as much as you need to focus on what your tasks are and what your strategies are in your work life, you need to do the same in your social life, in your family life, in your community life. And so don't ignore those. Don't ignore your church groups. Don't ignore your social groups. Don't ignore your workout groups. So that's easy to say, very difficult to manage in terms of time, but that's the task as any leader needs to do. And that really hasn't, the pandemic has exacerbated it,
Yeah.
but it's always been there. And as any physician or nurse will tell you, that just because your shift may end or your office may close doesn't mean that you can forget about it. It's the same thing in your social life or your family life. Just because you're not there doesn't mean you can forget about it and pick it up whenever you want. So pay attention to both sides of your life.
Yeah, I forget who it was that said that he doesn't know anyone who wants chiseled on their own tombstone, "I wish I'd spent more time at work."
Exactly right.
Yeah, and it is that kind of balance is there, and of course there's no single balance. Everybody has a different way of striking it, and but that's really re-energizing the battery. It's and it's so important, and we're seeing that certainly in the academic world, and I know that it's everywhere for those that are on the front lines of healthcare. And as you say, it's become a problem very much exacerbated by all the experiences we've had in the last 24 months. Well, everybody, thank you so much for your time today. I do so appreciate our panelists today, our awardees, and I, in particular, want to thank Heidi and her team for putting this event together and the video and so forth. So again, let's thank our participants today, congratulate our awardees, and on behalf of the School of Public Health, let me offer you all of our heartiest congratulations for your contributions to public health, to healthcare, health systems one last time. And to each of our awardees, I want you to know that your dedication is truly inspiring, and you are all exemplars of health leadership and achievement. And I want to thank everybody here who joined us today to celebrate the careers of these amazingly accomplished men and women. And I do hope that we will see you again soon. And I think the sun is sort of coming out, so I hope that we will all have a good day, and please stay safe and healthy. So long.